everyone. My name is Kassandra Carrion, and I am a third-year medical student at SUNY Downstate College of Medicine. I am currently a research fellow with the Department of Plastic and Reconstructive Surgery here at Stanford University. I'm pleased to present our work titled Program Director Perceptions of Parenthood During Plastic Surgery Residency. In March of 2020, the American Board of Plastic Surgery approved 12 weeks of personal leave for maternity, paternity, medical leave, foster care, adoption, family leave, or elective rotations. 2 years later, in June of 2022, the ACGME released a mandate requiring 6 weeks of paid leave for medical, parental, or caregiver leave. Since the most recent policy in 2022, only 2 studies have taken a standardized approach to reporting PRS residency policies for residents who are parents. So in order to study the program director attitudes towards these policy changes, we sent a survey to all integrated plastic surgery program directors. A total of 34 program directors filled out our survey, bringing our response rate to 38.9%. Within this population, as we can see in the pie chart here, 83.9% of program directors did have children. Now, in terms of when they had children, we found that most program directors had children during residency and as an attending. 38.5% had children during residency and 38.5% had children as an attending. With the knowledge that most program directors had children at some point during their training, mainly residency, we were interested to see if they had knowledge of accommodation for nursing mothers in different important aspects of plastic surgery training. So the first question we had was whether they knew if there were accommodations for nursing mothers in the in-service exam. 67.7% said that they were unsure about whether these accommodations existed. In terms of the written boards, 80.6% were unsure about whether there were accommodations for nursing mothers. Now, in terms of their individual hospital policies, for nursing mothers that were operating, 64% said that their institution did have accommodations for nursing mothers, and 22.6% were still unsure. When we asked program directors whether their institution covered fertility treatment, 51.6% were unsure about whether this was the case. Now, in order to assess the adequacy of leave times presented by both policies that I mentioned before, the 6-week ACGME policy and the 12-week American Board of Plastic Surgery policy, we were interested to see if there were differences in perceptions of whether these were appropriate for childbearing and non-childbearing residents. When asked to what extent they believed that each of these time periods were adequate, 32.3% of program directors disagreed versus strongly agreed, 22.6%, that 6 weeks was adequate for childbearing residents. For non-childbearing residents, 45.1% thought that this was enough. For childbearing residents, again, when we looked at 12 weeks, there was actually no consensus between program directors, where 35.5% agreed, 25.6% strongly agreed, and 22.6% disagreed that 12 weeks was an adequate time for leave for a childbearing resident. For non-childbearing residents, there was pretty much a consensus that this was an excessive amount of time, where 38.7% disagreed and 22.6% strongly agreed. We were also interested in assessing current hospital policies to see whether or not program directors thought that they were necessary. When asked whether program directors believed that their program salary was sufficient to support one resident parent and one child, a significant amount, 64.5%, believed that the program salary was enough to do this. They also agreed that hospitals should provide childcare, with 41.9% stating that they strongly agreed that this should be the case. Despite this, they did not believe that having a child during residency affected childbearing residents, whereas 48.4% did not believe that this was the case, and for non-childbearing residents, 54.8% believed that wellness was not affected. Given the rise of residencies unionizing, we were interested to see whether program directors believe that residents' unions will actually advocate for effective policies for residents who are parents. We did actually see a geographic trend in this data. Program directors in the Northeast actually disagreed that resident unions will effectively advocate for reasonable parental leave and fertility policies. So what does this tell us? It tells us that a majority of program directors had children, 38.5% of them had children during training, but a majority of them were actually unsure about the accommodations that existed for nursing mothers during the written boards and the in-service plastic surgery exams. We also saw, notably, that program directors in the Northeast did not believe that resident unions would advocate for reasonable parental leave and fertility support policies. Therefore, we believe that more research is needed to assess geographic trends and program director attitudes towards resident parents and how this can affect individual hospital policies. Interestingly enough, the ACGME parental leave policy is actually less than what program directors believe is appropriate for childbearing residents. And even though residents are paid less than the national average, most program directors actually believe that their institutional resident salary is enough to support not only them, but one child as well. They also believe that hospitals should provide childcare, but this is only the case for 30% of hospitals in the US, where 60% of hospitals in the US do not provide childcare. Despite these discrepancies, program directors do not believe that having a child during residency affects wellness for residents. And therefore, we believe that future research should evaluate resident attitudes towards these policies and compare them with program directors. Thank you very much for your time.